Hello, I'm Dr. Joshua Sabari, Thoracic Medical Oncology at NYU Langone Health Perlmutter Cancer Center in New York. I'm also the editor-in-chief of Cure Magazine, and I'm really excited to be joined today by my colleague, Dr. Nausheen Ahmed. Dr. Ahmed, please introduce yourself.
Hello, I'm Nausheen Ahmed. I'm a transplant and cell therapy physician at University of Kansas with a specialization in cellular therapy. We had a great ASCO for the myeloma and lymphoma fields, and I'm gonna highlight some of the studies that were presented that were interesting. Again, my space is mostly CAR T, but I'll talk a little bit about myeloma. So in myeloma, we had newly diagnosed myeloma. We had results of PERSEUS trial, which was a phase 3 trial looking at subcutaneous daratumumab VRD with dara and lenalidomide maintenance in transplant-eligible patients with newly diagnosed myeloma, and comparing it to the control arm of VRD and lenalidomide, which clearly continues to show improvement in PFS, CR, and MRD rates. We also had data on the ADVANCE trial, which was a randomized multi-center trial of bortezomib, lenalidomide, dex, with or without daratumumab in newly diagnosed myeloma. Of course, these were transplant-eligible patients. Stem cell collection was allowed after 4 cycles. And in this trial, we do see a significant increase in MRD negativity rate, that's 10 to the power minus 5, with no new safety concern using DKRD compared to KRD. So again, more options for patients. And then we had results of, I just wanted to highlight the third trial here, which was for newly diagnosed myeloma, which is Magnetism 6, Part 1, which includes elranatamab in combination with daratumumab and lenalidomide in newly diagnosed myeloma patients that are not eligible for transplant. Results are promising in this as well. Just moving on to the relapse refractory myeloma setting, we had long-term data from CARTITUDE-1 trial, more than 5-year follow-up, which is really exciting and really got the community excited that this is a really difficult to treat population in relapse refractory myeloma. Most patients in this population on this trial had up to 6 lines of therapy. And we all know that the prognosis is really poor for such patients. But here with CARTITUDE-1, we see with cilta-cel, at 5 years, 1/3 of the patients were still alive, which is pretty remarkable and pretty exciting. Other trials that I also wanted to highlight, other reports, were the Iraklia trial, which was reported. It's a new, it's giving isatuximab in a different way using an on-body injector, which is also great for patients. It involves, the trial was isatuximab subcutaneous via on-body delivery system versus IV form of ISA, which is the traditional used form of isatuximab, which we currently have, along with POM and DEX in the relapse refractory myeloma setting. And here we see that, and it's basically a non-inferiority trial. So we see fewer infusion reactions, higher patient satisfaction, and it has the potential to increase practice efficacy and is likely to be adopted in clinical practice. And yes, we have also first in human study of J&J 5322, which is a novel tri-specific in patients with relapse refractory myeloma. It's a phase 1 trial, also looking promising. This is something to watch out for in the future. And then just moving on, I'll talk about lymphoma, focusing on the CAR T and cell therapy aspect. the phase 1 study, Kite 363, which is a bicistronic CD19 directed, was presented. It's a phase 1 study, and it showed a good safety profile and efficacy profile, and this is another mechanism, we hope, another drug that might come in the future to improve outcomes with our currently available CAR T. And we have also presentation, pretty interesting, multi-virus specific T cells to enhance activity of bispecific antibodies. So here we look at bispecific antibodies, which have the advantage compared to CAR T presently of being off the shelf, and however their clinical activity relies on T cell function. And here we have the addition of multi-virus specific T cells, which are supposed to have increased cytotoxicity and ability to reach tissue, essentially, to work synergistically with the bispecifics, increase efficacy. Those are the main abstracts of interest. I think there's just one other thing to highlight, is that there were 2 abstracts. One from presented by a poster that was presented by the VA, the Veterans Affairs, that showed that CAR T cell therapy is still not utilized as in eligible patients as much as we'd like it to, and it seemed that referral for CAR T seemed to be the main barrier to these patients getting CAR T. And another poster looking at how do we optimize the time and in monitoring of CAR T. This was presented by this is one of the posters that I had, which was I co-authored it, which looked at, instead of keeping patients for 4 weeks post infusion, they could be kept for just 2 weeks, since most of the toxicity was within 2 weeks. And this could be practice changing in terms of increasing access as well.
Thank you, Dr. Ahmed. That was a beautiful and exhaustive list of different abstracts presented at ASCO 2025. It's great to hear that the amount of therapies being developed and approved for our patients with hematologic malignancies. Thank you for joining us, and thank you for imparting your wisdom on our cure readership. It's a pleasure to meet you.
All right, thank you. Thank you.